is Kristin Davies. I'm a nurse on our neurosciences floor, but I also cover for our stroke coordinator who provides education to patients whenever they come in with a stroke diagnosis. One of the most surprising things that I've learned is that patients will wait for long periods of time whenever they have stroke-like symptoms. They'll think it'll go away or it's not painful, so it's not something they need to deal with right away. And by the time they realize that there really is a problem, they've lost the window of opportunity to have some of the medications that could help reverse the side effects of strokes. People respond to pain, and strokes are not always painful. At least initially they're not painful, so it's not as of an emergency to them. Heart attack, everybody knows you have pain, call 911 right away. Strokes, it's like, oh, my face is a little weak, my speech is a little slurred, maybe I didn't get enough sleep, maybe I'm getting sick. And so they just don't think about it the same way they think about a heart attack. It's not an emergency to them. It's a wait and see, maybe it'll go away. If it doesn't, I'll make an appointment with my doctor. And unfortunately, by the time they actually get around to going to the doctor or going to the hospital, it's too late. Whatever effects the stroke has had on them, they're most likely going to be permanent, or at least far more debilitating than they would have been if they had gone to the hospital immediately. I definitely think that people need to be aware of what the signs and symptoms are, but also the fact that if they have those signs and symptoms, it's an emergency. I think that is the key to everything, is that if they have the signs and symptoms, don't be afraid of calling 911 just because it may be a false alarm. It's better to have a false alarm than have the effects of a stroke for the rest of your life. The signs and symptoms of a stroke can vary depending on where in the brain the stroke originates and whether it's a blockage or a bleeding stroke, but they would most likely be weakness on one side of the body, facial weakness, limb weakness, slurred speech, or just not being able to understand what people are saying, some type of visual deficit where it feels like people can't see on part of their body. Those would be the largest signs that people would have that are the most commonly talked about. May is Stroke Awareness Month, and every year Mayo has a Stroke Awareness Day. For 2011, our Stroke Awareness Day is on May 13th from 7 a.m. to 3 p.m. It's going to be in our Kinney Auditorium. It's free to the public. You can come and go as you please, but we do have some of our physicians speaking about strokes. So it should be an interesting day for people to get some education, but also hear some of the stories the doctors have about real people.